Hi everyone, welcome back to Face It with Dr. G. I'm Dr. G and I'm so excited to be back here with you today. We took a little hiatus as a lot of people with podcasts and YouTube channels do. Didn't plan on it, but life just happened so quickly. And so now we're back in 2024 and so excited to deliver amazing content to you guys. Still very acceptable of your feedback. We want to hear what you want to hear about and learn about. So let us know. Feel free to comment and let us know. So today we wanted to talk about the difference in sleep lines versus dynamic lines or dynamic wrinkles. Sleep wrinkles versus dynamic wrinkles. And there's not a lot of talk or research about sleep wrinkles, and I think it's important as an injector to be able to distinguish one from the other and to understand what treatments are available for sleep wrinkles because they're not caused by dynamic facial movements or animation. So I'm going to go through these and I hope you enjoy. So we develop wrinkles initially as superficial fine lines, and wrinkles can develop due to intrinsic factors and also external factors or extrinsic factors. And the dynamic facial movements that we make every day when we animate and we talk and we move our eyes and blink, those are movements that cause lines that are perpendicular to a muscle. So for example, if we have a muscle like the frontalis muscle that runs from the eyebrows all the way up to the hairline, that is a vertically oriented muscle. We develop lines that are perpendicular to that or horizontal. So that is how we understand the pattern. With sleep wrinkles are vertical lines, and we're going to go through why this happens, but sleep wrinkles happen because of external forces. And as you may be able to relate, this is women more than men really. Women like to sleep on their side. Men typically will sleep on their back, but women prefer the side, and this comes with consequences because over time that tension and pressure and shearing forces will cause lines, and these lines are vertical. You can actually you can form those lines by just pushing pressure on the face, placing pressure on the face, and demonstrating where those vertical lines lie. So sleep wrinkles usually are caused by external forces, and they're also usually located at the point of true ligament insertion. So this is where you have ligamentous adhesion and connection from the skin to the bone, and there's some reasons why that happens. So now you have a little bit of an idea of the difference between a dynamic wrinkle and a sleep wrinkle. And sleep wrinkles are mostly from external forces. Dynamic wrinkles are from muscle movement. Okay, so wrinkles have been classified into systems, and this is primarily for dynamic wrinkles. And I wanted to go through this classification system and then just hypothesize, maybe we should make a classification system that includes these sleep wrinkles. So let's go through the different types of dynamic wrinkles. So the name of this classification system is the Pirard classification. I don't know if I'm pronouncing that right. Pirard. Anyway, so this classification system, the first type is atrophic wrinkles, and these wrinkles develop in both sun-exposed and non-sun exposed skin, and these are caused based on depletion of the dermal contents, specifically the extracellular matrix. So hyaluronic acid, elastin, collagen, glycosaminoglycans, etc. So as our dermis depletes in thickness because of depletion and damage of these extracellular matrix proteins and components, we develop atrophic wrinkles. So think atrophy of the skin, atrophic wrinkles. Okay. Number 2, elastotic wrinkles. So elastotic wrinkles, elastosis refers to the term solar elastosis, and solar elastosis is when the elastic fibers of the dermis become elastotic or thick and firm and non-elastic. So they're not compressible or stretchable. They are very hard and firm. And because of this, you get lines that are set in place because that dermis is less flexible. So those are elastotic wrinkles. Number 3, these are expressional wrinkles, or the dynamic or the animational wrinkles that we've already discussed, and these are due to those dynamic movements of the face from the muscular contraction. The last category is gravitational wrinkles, and these wrinkles are formed from the skin sagging, which is due to depletion of those fatty tissue layers and shifting of those tissues downward, and also due to gravitational forces. And these are also wrinkles that can be due to external forces. So, where do sleep wrinkles fall in here? Well, we don't know, but they're due to the extrinsic factors like tension and pressure and shearing forces that cause lines to develop over time. So what happens under the microscope in aging skin? Well, aging skin happens, it's just going to happen regardless of if you try for it not to happen. But it can be accelerated by UV exposure and sun damage. So as we age, if we didn't have any sun exposure, our skin actually thins. But in sun exposed areas, the skin thickens. And it thickens because it hardens, it's less elastic, you get damage to the collagen and elastin, you lose hydration, you lose proteoglycans and GAGs, or glycosaminoglycans, that hold on to water molecules, and you also lose hyaluronic acid, which these are all components of our extracellular matrix. So if we're aging and we also have sun exposure, then we're getting fine lines and wrinkles, we're getting thickening and hardening of the skin, and you can imagine once the skin is thick and hard, you really don't get any softening of those lines that are already in place. You also can get thinning and flattening of the dermo-epidermal junction and the reedy ridges that are naturally found between the epidermis and the dermis. And there are things that we can prevent, which is sun exposure, but there are things that are innate in our genes and our genetics, our DNA, that can cause one type of aging versus another. So some people are more prone to degradation of their dermal components than others, and this is in your genes. Other factors that influence aging include, obviously, age, smoking, UV exposure, genetics, hormones. Okay, so let me go through a little bit more of the biomechanics of skin aging. So the skin is always under intrinsic tension. And as we discussed, there's external factors that can also cause lines and wrinkles, but internally, our skin is always being stretched and pulled in different directions. And these are called the Langer's lines, the skin tension lines. For you, those of you in medicine, or those of you that aren't, you can Google this and you can see where the skin tension lines are throughout the body. So in younger individuals, we have multi-directionality of these skin tension lines. So they're pulling in all different directions, that tension under your skin. And over time, as we get older, those tension lines become more unidirectional. And as those tension lines are more unidirectional, the collagen and elastin and fibroblasts start orienting themselves in those directions and lay there in that way. So if you can imagine, when you're younger and your collagen and elastin are being pulled in different directions, you're not going to develop lines and wrinkles because your skin tension is not in one place for an extended period of time. But as you get older and your dermal tissues become more firm and stiff, and your collagen and elastin start laying in one direction, you can imagine how a line or wrinkle that maybe was superficial at the beginning then gets settled in and becomes deeper and more permanent. So in younger individuals, in your 20s, early 30s, you have development of those superficial lines and wrinkles that will come and go, and they essentially go in a bunch of different directions, but you'll start to see them. They don't stay for long periods of time, but there are more of them actually in 20 to 30-year-olds. You'll see more of those lines of animation actually. As you get older and your collagen starts to become more unidirectional, those lines at rest that are in there permanently are actually fewer in number and further from each other. There's more space between them. So this just demonstrates how we have mechanical and chemical signals essentially that are dictating what happens underneath the skin and how we age, and all of the different forces that contribute to those signs of aging. So let's go back to sleep wrinkles. They are less predictable in their location, but I will tell you where we tend to find them. Less predictable in their location. They are vertically oriented, and they have a different etiology than those dynamic movements that create those expression lines and wrinkles. Sleep wrinkles are postulated and hypothesized to develop based on sleep position and sites of SMAS, or superficial musculoaponeurotic system condensation. And as we age, we tend to move less in our sleep. So there are some numbers that are thrown out there, but in our younger years, we move about 27 times a night, and as we get older in our 40s and 50s, it decreases to around 16 movements per night, which is about an average of 20 movements per night over the course of your lifetime. And you can assume that the longer you're in a position when you're sleeping, the more likely you're going to develop a sleep line. So when you're younger and you're moving around a lot more, you're not going to develop the lines as readily. So sleep wrinkles tend to develop along the attachments and at the attachments of the true retaining ligaments. And they tend to form at the medial border of the mobile tissues. The central medial sleep ligaments are the only ones that are not associated with a true retaining ligament adhesion point. So the retaining ligaments that are key here are the superficial temporal septum, the orbicularis retaining ligament, the zygomatic ligament, and the medial cheek junction. So the common sleep wrinkles that you should be aware of, both at home or in your practice or wherever you may care about, are these. The lateral or oblique forehead crease, which is a vertical line that extends through the eyebrow and laterally up the forehead. The radial orbital crease, which is a little bit more lateral, associated with the tail of the eyebrow that travels obliquely and vertically. The lateral vertical malar crease, which is right on the inferior lateral orbital rim from that cheek pushing up as you sleep. And those are usually two little lines that you can see there that hopefully disappear as the day goes on. The medial cheek crease, which is right at that cheek nasal junction. The nasal lip crease, the lip corner crease, the oblique marionette crease, the preauricular crease, and the inferior vertical cheek crease. So those are the ones that you should be aware of, especially when treating patients. And now I know you're dying to know, does neurotoxin treat sleep wrinkles? And the overarching answer is no. But as I searched through the literature, I realized there really wasn't a clinical study or any sort of observational study of patients that followed them after their neurotoxin treatments to determine if there was any perceived improvement, right? Do neurotoxins directly treat the cause of sleep wrinkles? The answer is no, because neurotoxins treat the muscles, and the muscles cause dynamic movement, which causes the expression lines. However, there are patients that I do believe feel as though the sleep lines are diminished with neurotoxin treatments. And I think it would be interesting to look at that. So we'll see, you guys, a little bit of a hint. I think there should be more research done, maybe a small clinical study to determine if there's a perceived improvement. Because if we have a perceived improvement of something, hey, that's progress and that's awesome. So I hope this was really exciting and interesting to you. I think that sleep lines are very common, and patients come in thinking sometimes after they have had a neurotoxin treatment that, oh my gosh, I got this new line and it's worse now and I'm not sure what it is. And that's usually a sleep wrinkle. So that patient wouldn't have perceived an improvement, right? And it really depends on where those sleep lines are. For me personally, with my patient population, I've seen those forehead sleep wrinkles to be improved with neurotoxin. Other ones, not as much. But I think, again, it's an interesting thing to explore. So if patients think they have worsening of their lines, make sure you understand what those lines are from. Then you feel educated to tell them, actually, this was there before, but now you don't have movement of your forehead or around your eyes, so you see them more clearly. And then you can give them ideas and tips on how to potentially treat or prevent those sleep wrinkles. Get a silk pillowcase. Stay out of the sun. Try and sleep on your back. Get a pillow that's one of those specific pillows where there's no tension or forces or compression on your face. So yes, those are hard and you have to adapt to those life changes, but those are ideas. And I hope this helped. Let me know if you have any questions, and I'll see you guys again soon.